Hello, I'm here today at one of the Phoenix, Arizona Points of Pride, the South Mountain Park, which is a 25 square mile preserve in the south part of Phoenix and is the largest city park in the country. It was bought by the city of Phoenix in 1924 from President Calvin Coolidge's administration for a grand total, get this, of $17,000. And it is unbelievable. It's huge, it's gorgeous. There's actually a very high point behind us at South Mountain where a lot of radio stations have their towers because it's an unobstructed, beautiful view of the whole valley. You can see behind me downtown, and then the Chase Field where the Diamondbacks is over there as well. Very pretty. The topic for today is an update on Arizona medical marijuana. Prop 203 passed in November of 2010. That was 6 months ago. Since then, the Arizona Department of Health Services worked extremely diligently in getting together the rules, the regulations, going through all the processes to make that happen. And they did it. They worked out all of the systems so that patients who have the qualified debilitating conditions and go through the certification process from a licensed doctor can then apply to the state, and that happened April 14th, that went into effect, for an Arizona medical marijuana patient ID card. So that part is in the works. But the interesting part is now they're in the process of collecting applications for medical marijuana dispensaries, and the plan is to have 125 of them around the state of Arizona according to the Community Health Area Analysis. The most recent update that's happened in the last 3 weeks is that the U.S. Attorney's Office from multiple states are sending letters to those states saying that they are not going to look the other way necessarily, even if a medical marijuana dispensary is compliant with state law. That is different than the 2009 memo that came out stating that if people and corporations, companies were in compliance with state law, that is not who the federal government was going to go after. But that stance has changed. The governor of the state of Washington had House approval and Senate approval to put in place the medical marijuana dispensary program. She wrote to the U.S. Attorney's Office for clarification, like a prudent governor, should. And the letter that she got back said that not only would the federal government look to go after dispensaries who were in compliance with state law, but they might even go after state employees who were processing the applications and whatnot for the medical marijuana dispensaries. So, what was the governor supposed to do? She vetoed the law, and the program's not going to happen at this point. It looks like Rhode Island, the same thing happened. Here in Arizona, I have not seen the letter, but evidently a letter was sent to the state and the Department of Health Services discussing the same thing. So, yes, Arizona has medicinal marijuana legalized. Yes, they have rules and regulations for a patient to go through the process of getting a recommendation / evaluation and then recommendation for a patient ID card. And yes, they are allowed to grow his or her own marijuana. I think it's up to 12 plants until a dispensary becomes in existence within 25 miles of that patient. However, think about this. If you're a business owner and you spend a few $100,000 buying all the security and the cameras and technological devices for inventory, and then the hydro for the growing, you do all the right things to try and help these debilitated patients. You have a nonprofit organization, and you do it all the right way, and then the feds come in, for a raid or whatnot. Is still federally illegal. So that's the risk now, the risk level that it's gone to with this reversal of the 2009. So it'll be interesting to see what the next few months unfold. The federal government still has maintained that they don't want to go after individual patients that are in compliance with state law. They're really only going after those that are in, I believe it's the manufacturing and distribution of the actual marijuana itself. So we'll see what happens. That's a bit of an update. Visit our website at arizonammc.com. can also call toll-free 855-AZ-ID card to get your schedule for your evaluation today. Thank you.